I would like to thank to Professor von Braun, to His Eminence Cardinal Turkson, and to Professor Baumann, the possibility and the invitation to be here and share my thoughts with you. So it is often said that beauty comes from contrast, and I hope that in the end, contrasting my presentation with that of Professor Baumann, you will find some beauty in it. So I'm no longer, fortunately, the director of the Porto Comprehensive Cancer Center, so now I sleep at night, but I will share with you some of my nightmares. So I come from an old country, and you can see by that age pyramid that we are indeed old. And for many of us in Portugal, this should be a very worrisome graphic. Unfortunately, many people look at it and don't know what it means, but I'm sure that all of you that are here in this room know what this means for us in the very near future. And this is, I would say, our biggest challenge and our biggest menace. So this is our trend. So we are among the best in Europe in life expectancy. Unfortunately, this does not translate into quality of life for our elderly population. Unfortunately, our elderly population has probably one of the most reduced number of years with health after their retirement until their death, and that's also a big burden for our country. And at the same time, we are decreasing our birth rate and our fertility rate. So this is really very important for us because this explains very well the next figures, which are the cancer figures in Portugal, the most recent ones that I got from 2019. And we can see there that we had in 2019 an almost 20% increase compared to 2010. And so there are many reasons for this, for sure, but the aging of our population is surely one of those and one of the best to cover this. And you can also show there that 90% of our cancer cases occur in the population over 45 years. And this means that this burden will increase over the next few years. This was, I will not say a surprise, but a shock for me as a man, because I reached that point where those two curves already met. And you can see that before the age of 55, men are a little bit more protected than women for cancer. But after that, it's a disaster. So this is exponential. And I think this is a very good perception of the incidence of cancer and the disparity in cancer incidence and mortality in both genders. As a pattern, Portugal is not very different from other countries in Europe in terms of the main cancers. So in women, obviously breast cancer is the one that has the highest incidence. Then we have colorectal, we have lung, we have thyroid for some reasons that we can discuss. And in men, obviously, we have prostate, we have lung, we have colorectal. So a pretty much pattern similar to many of our brothers and neighbors in Europe. But we have a lot of disparities, although we are a quite small country, I would say. We have geographical disparities in incidence. You can notice there that in the northern part, from where I come from, we have one of the largest incidences in Portugal. So there is a regional challenge for all of us. But there are also disparities in terms of the cancers itself. For instance, gastric cancer, which probably for most of you is not a very worrisome problem, for us it is. And in the northern part of Portugal, gastric cancer is actually a problem. It's something that we see almost every day, and it's a challenge in terms of public health. So if we have this kind of disparities, even in a small country, it's important for our health services to be linked to this. Nevertheless, I would say that we are dealing very well with cancer in terms of our outcome. It looks like cancer mortality is rising when we see it grossly, but if we standardize that growth rate, we can see that mortality is actually stabilizing or even lowering in our country. This means that we are doing a big effort to treat well our patients. So let's go for organization if that exists. So we have a national healthcare system. In that regard, we are more simple than Germany. We are actually inspired in the national health system from UK. That was our blueprints where we started, and it is a public, universal, almost free, I would say, and it goes from primary to tertiary care. So this was one of the big conquests of our revolution about 50 years ago, and it was very important for our democratic system and to show people that there was really something to come out from it. But things are not ideal, and now they are reaching a state in which people are doubting that that was really the case. We have a regional level of administration, not very effective. I'm no longer a politician, so I don't care about it. So I can say this stuff, not very effective, unfortunately. And very recently, we have now what we can call an executive board for the whole system. It started in 2022. It's their first steps. We have a lot of hope, and I hope that in the next few years, they can show that there is something different to do and they can do it well. So let's go for the data that we have on cancer in our country. So this is from 2020, and we have 47 public hospitals that deal with cancer. But just to tell you that there is a growing number of private hospitals that also treat cancer patients. They diagnose cancer patients, they treat them, and they follow up them. So this is not the whole universe of cancer patients in Portugal. But only 9 of these public institutions have actually all the core disciplines to treat cancer patients. And this is a problem, as we can see. I would say that the good information here is that we have a multidisciplinary team meeting in most of these centers. So we can assure for patients quality in their treatment. But we have problems. We don't have enough personnel for most of these cases. We have a shortage of not only medical doctors, but also of nurses, of technicians. And I can mention here mostly the medical physicists, because this is, I would say, a species in extinction, and is a very important one. It's now being, I would say, grabbed by public and private because there are not enough of them. They earn more than a medical doctor these days, and they are offered very handsome salaries because they are so few, and you have to have them at your hospital, that this is really, I would say, a very popular profession these days, but we don't have many of them. So 80% of all our cancer cases are managed in those 19 institutions. And this means that we have many hospitals that have a very few number of patients coming in. This is a problem because if you have too much, you will have to deal with a lot of patients every day, it's true, but if you have too few, you will not have the proficiency that you need to treat well this patient. And so the threats and the shortcomings, a politician would call this the challenges, is that we are dealing with a shortage of specialized care. We have an unbalanced distribution of the professionals across the nation and across the institutions. And we talk about a lot of patient centricity, but believe me, words are one thing and facts are the other. We have worked a lot in reference networks. I worked in the one from pathology, my discipline, but we never thought of a network for the patient. We think of networks for the medical disciplines. And we have also a rapidly expanding private healthcare sector. I'm not demonizing this healthcare sector. It's just taking care of the inefficiency of our public system. You know that nature has this horror for void, and once you have void, it will be occupied by someone else. And this is what's happening in Portugal at this time. And the last phrase, I think I could summing up in another expression in Portugal, which is, if you don't know where to go, any way will do. So if you don't have a strategy, you can take any way, but it will not lead you anywhere. And this is what kept me without sleep every night when the 3 years I was in my mandate. And this was the 10% increase that we had every year in medication that we had for our patients. And this, that some people call financial toxicity, is a problem for all of us. This is really something that is putting in danger the whole system, and that we need, I think, a global view at this and a global strategy. So what do we need to do? Well, we have to promote quality, equity, obviously. We have to harmonize things like the cancer screening programs in Portugal. They are not harmonized, they are regional, and they are very different across the country. And we have to make this patient-centered. This means that we have to work on the EPRs, we have to make data flow between the country and across the hospitals. And very importantly, and this was also mentioned here today, we have to foster continuous education, we have to foster clinical research, basic research, translational research. And to do this, you need organization. You don't need to invent the wheel. Simon has just shown you the wheel. We can refine it. And I think that the wheel that we have at this moment is the fact that we have 3 centers that were OECD accredited and work within that system. And I think that they try to do that job within it. This is not enough. So now we need to build upon this system, and we need to develop these comprehensive cancer networks in the country so we can outreach all the patients that need our help. And obviously, we need to engage in European level platforms. Like you see here, we are involved in all these initiatives. And what we need now at this time is to implement a national strategy to fight cancer. I think this is what is really holding us back. There is a paper on this, but it takes some time to reach that. This is my first high-risk statement in this conference, is sharing with you an idea. But fortunately, here I'm protected. I only have here one fellow countryman, and I'm sure that he's a very compassionate person, and he will not share this information with the health authorities in Portugal. Professor Manuel Leitor is a very good friend. He will not do that for me. But this is just a way of sharing with you that, and this was inspired by our recent brain meeting that Simon also attended, and some of you probably did as well. And this is the way of looking at the system in a collaborating and networking way. I don't want to put here names of structures. I don't know enough for that. But I know that we have the places, we have experts, we need the means, and mostly we need those arrows. How people connect and how do they collaborate. And my final and last high-risk statement is to tell you that we are talking a lot about our inequities and inequalities in health, but we are privileged. I often say to my students that we are privileged because we, sorry to say this, we can die of cancer because many, many people in the world die of hunger, die of violence, and die of infection. So sorry to say this way, but it's a way that I try to arise their attention to other things that exist in life and not just cancer. So here is just to tell you that although we have a lot of difficulties, we are trying to help others. And we are trying to do this in Africa, and Africa is very important, not only because of our historical and cultural ties, but because Africa will be the center, I can say, sorry for the term, of a pandemic of cancer over the next 20 years. So you can see here from these African countries that are connected historically to Portugal, that we expect to double the incidence of cancer over the next 20 years. So if this is not something that should worry us, I don't know what should be. What are we trying to do? We are trying to help them to follow a way and to set up units that can help them to fight cancer. Okay, we can say that this is just a small drop in the ocean. Yes, it is, but it's better than doing nothing. And you cannot imagine how important it is for these people to go there, to take them to Portugal, to be 1 year with us in training, to go then back with them and be at their side when they start their activity in cancer, and to know that they can always come back to us for advice and for collaboration. This is not the work of just one person. I have here to acknowledge the Calouste-Gulbenkian Foundation because they saw in here some kind of virtuous strategy. And this is just to remind that cancer is not just about physicians. We have a lot of other healthcare personnel that needs training, that needs motivation, that needs to work with us. And this is not just also the role of hospitals. There are a lot of institutions that are important to do this. It was not on purpose, but I use the same, the same expression that Professor Lowy used when I looked at this initiative. And what I hope for the future is that I can travel with you and go far in terms of cancer. Thank you.